Vincent, your turn.
I have worked closely with Honorable Millie in civil society, so I understand the space and appearing even before these meetings. I think for me, I would just want to highlight, as a public policy expert, I'm actually in that space, things that for your considerations. One is that as a part of the technical team that worked on the reproductive health policy, there is need to look at the bill by looking at the lenses in which that you to look at the bill, and since you've told me to reduce to do it quickly, I'll just point out 5 things that or 4 things that the bill should speak to. Number one is that the bill should address the issue of inequalities in access of reproductive health care. So I'm giving parameters that in terms of processing the bill forward, what should the lenses in which we should look at. And because I have looked at the policy locally and other dimensions, a legislation comes to facilitate the realization of a policy. What can we do to improve on the bill? So if I can do justice by pointing out the principle or the issues. One is addressing the issue of inequalities and access of RH services. 2 is the issue of quality. Number 3 is the issue of informed demand. And then the fourth is the issue of partnership. The number 1 is the bill needs to be, number 3 is the issue of informed demand. And then number 3 is then the issue of partnership and collaboration. I would say if those are the things, the lenses we need to look at the RH bill. And then I want to buttress a point that Honorable Melia has outlined on the issue of ensuring that when we have reproductive health, is that it takes care of the 6 cycle of life. So the comprehensiveness of the legislation. And then finally, I want to outline something, senators, is that if you look at the financial audit, I said, and you look at the financial allocation of provision of RH services, you realize that it has been, there's been an underinvestment in this sector, particularly by our local resources. So since we are dealing with a house that allocates resources, it's also important to appreciate that dimension. And then finally, when I look at the bill, and I hope I had enough time, is that there's also the element of reporting and the element of monitoring, so that we have informed decision. As you know, the dispensation we're living in is the dispensation of evidence-driven policy making. So I have not seen a mechanism that facilitates that if we were to come to the place of review, it will be driven by data. Senator Kiika, let me be disciplined by just stopping at that and saying that when that time comes, we should be able to then provide the framework that ensures that we are that ensures that meets the following. 1, Article 10.2 that really binds all actors in terms of our values in informing policy development. 2 is then in view of the principles I've outlined, and then 3, the facilitatory for informed review, and then informed evidence that's informed objective improvement of the legislation, because there will be, that will then ensure sustainability of this legislation, comprehensiveness, and also, please understand, Honorable Senator, the hit that is currently in the legislation is what Charles has outlined, that when it comes to the area of reproductive health, morals come in. And you know, there will be passionate conversation. But I hope that there will be, we will be men and women enough who will rise to the position to ensure that we bestow our country with a legislative framework that is for posterity, that will stand the test of time. I think we started in this framework when you said that every parliamentary session starts with a prayer. And there was a reason why that was. It has stood the test of time. When you look at our national anthem, when we were reviewing our constitution, you notice one thing: we did not review the national anthem. It means it's the foundation of that anthem was, it stood the test of time. May we rise to that occasion in this process. Merci beaucoup. Thank you very much. Asante sana.
Thank you very, very much, especially for being so brief. And we look forward, really, to that.
Because I think it's important we leave you as our leaders with a correct position. Article 26 does not give doctors the right to kill. And it is very unfortunate that we would hear here a doctor say that they have been terminating pregnancies because of abnormalities of the baby, because it is not constitutional. And when the justification is that it is the opinion of the mother is given the options and she chooses whether to kill her child or not, and the doctor is only providing service, then it means the doctor did not give a professional opinion. So it is that kind of mischief we must be careful with, because if the same written document in law can be translated by two different practitioners to mean totally different things, you cannot afford to have ambiguity in this bill.
Thank you, Dr. Wahome. And now,
I wanted to say that our perspective is that health and morality are not in competition. True health includes moral health, and true morality facilitates health. So that the approach of competition between the two ends up going at the expense of one of the two. So and that's one of the reasons why we're saying that the philosophy of the bill is important we get it right, because we want the two to act in harmony. The other thing that I think I wanted to say is that on matters of surrogacy and assisted reproduction, again, we should not put the rights of the mother in conflict with the rights of the child. Because when the mother has a child, that child has rights which under Article 53 of the Constitution are paramount. So a true approach, understanding of assisted reproduction, recognizes and harmonizes the rights of both the mother and the father, that is the parents on one side, and the child. And in certain situations, the rights of the child have to be given priority. So what I would like to say is that we have really welcomed this discussion we've had and the dialogue. And to finish by saying that kindly, as we go forward, let us not characterize, I'm not saying you are doing it, but I'm just saying in general, let us not characterize the concerns of the religious community as being not based on the content of the bill or their understanding of the bill. It is based on the understanding of the bill, and dialogue creates light. Positions are harmonized, consensus is built. But the concerns that are being expressed are genuine, they're legitimate, and they are for people who are in the grassroots, like the members of parliament in the grassroots, engaging women and men in hospitals, in religious institutions, educational institutions, in society. We are meeting people where their need is. We are coming now to present their concerns and saying, let us align them with our values, because it is possible. Thank you very much.